um, you already explained what functional medicine is, but how does it relate to acupuncture and traditional Chinese medicine?
Fantastic. So, like traditional Chinese medicine, it is a root cause based medicine where we're not just treating symptoms, which is the current allopathic model. I have this disease, you get this pill or this operation, right? Or it's completely different than that. We start everything off. We go back and we look at the diet, we look at your sleep, we look at lifestyle. Like, are you exercising? Are you moving? Are you meditating? What other things can you be doing to reduce inflammation or stress or anxiety? We'll ask questions. The intake process seems like it was modeled after Eastern medicine because it's very similar. Like, we ask hormonal questions like, what is your sweat like? What are your bowel movements like? What is your digestive process like? What are your ear, nose, and throat questions? What is your urination like? How do you sleep at night? Do you feel rested? Like, all these type of questions that are pretty much identical to the 10 questions that you would find in the all the way going back to the Yellow Emperor's Classic of Internal Medicine. So a lot of similarity there. And then a lot of times it's just complementary. So a lot of people practice functional medicine without the acupuncture in Eastern, but I think they're losing out. Where we really see a difference and where we shine is we can treat you with the functional medicine, which would be nutrients and dietary wise, but then we also have those constitution and the body types and the 5 elements and the things that we're looking for, like yin and yang deficiency and qi deficiency, and from an Eastern medicine side. So we can combine herbs with nutrients and supplements and food therapy from the Eastern medicine, along with nutritional advice. And then on top of that, if we're trying to reduce inflammation or get your stress levels or your adrenaline and your cortisol levels down, then we can combine the acupuncture with your functional medicine plan. So you just get much better results. It's like functional medicine on steroids when you combine the two.
Next question. You kind of
Mhm.
talked about your background in Tai Chi and Qigong. How do you incorporate it in your practice? And do you use other modalities in your acupuncture, like moxibustion or
Mm.
cupping and aromatherapy?
Absolutely. So great question. So on the martial arts side, I've been a little bit dormant the last 3-4 years since I had both my kids and the pandemic, and we opened 2 new clinics. But before that, I was actually teaching professionally for about 15 years and training probably 7 days a week. Now I am not as active. I'm kind of more focused on the business and the family. But to answer your question, yes, I do. Depending on the patient, right? Depending on what they're coming in for. If they have an issue like stress, anxiety, depression, trauma, insomnia, or I just think that they, need it, then I will prescribe maybe certain qigong exercises or certain breath work or certain internal like Neigong type of stuff, visualizations and meditations to help them facilitate the process and to help the nutrients and whatever else we're doing for them work better. On top of that, I host retreats. We host these holistic retreats so I'm still teaching, maybe once a month. During the pandemic, I was teaching a lot online as well, and I've just become too busy for it recently. However, I'm hoping in the near future to get more involved, and as my kids get a little older, get back into teaching and studying more on a regular basis. But I do incorporate them. And as far as the other modalities, yes, we love moxibustion. Moxibustion is actually more popular than acupuncture in China, which a lot of people don't realize, because you can get moxibustion at pretty much any massage place, and mothers will use it at home on their kids, and they use it kind of preventatively. It now not as much. Western medicine, unfortunately, has kind of taken over the East, and most of the hospitals and everything are all Westernized. However, it's still very prevalent in society and very well known. And here in the U.S., moxibustion is not used as much because of the smell. People have the aversion to the smoke and the smell, but we do use it. We use sometimes we use smokeless, or we'll use little canisters that keep the smoke in. We do cupping. We do some tuina as well. We do some gua sha, some scraping as well. We do injections. We do trigger point injections, vitamin injections with like homeopathic substances and PRP. So yeah, we use, whatever is going to be best for the patients. And we prescribe a lot of herbs. I have actually some of my raw herbs on the shelf, and in the clinic, we use a lot of patents, whether they be concentrated formulas or, pills and different things like that. So we're pretty comprehensive on the Eastern medicine. And obviously, as we're treating everybody, we're always using the yi to guide the chi, right? So, unbeknownst to the patient, but as we're doing our acupuncture, a good practitioner, not saying that every acupuncturist does, but a good practitioner should be leading his chi to achieve the desired results or create, additional circulation or stimulate the chi so the patient can get the best results. And then we get out of the way and let their chi and the chi of heaven and earth kind of intertwine with the patient and let it sort themselves out. We're kind of just the medium. And then, in my experience, autoimmune conditions, a lot of them are going to be internal based. Diet has a huge, role to play in that. Environmental toxins, stress, as well as to some extent genetics as well. But it's a combination usually of all those things. And I've seen tremendous results with acupuncture alone and with acupuncture and herbs for autoimmune diseases. And then when you add in the functional medicine component, we usually do very well with autoimmune conditions.